Good afternoon and welcome to Health and Living with me, T. Xiao Ik. It's the Psychiatry series today and we are discussing the role of community advocates, groups or organizations in the community that can advocate for better mental health, that can help to connect people who are in need of services with the professionals who can provide them. And we often discuss mental health through a purely medical lens, focusing on treatment and therapies. But when you take the healthcare system out of the picture, you are left with a person who is struggling with day-to-day activities within their community. And so that's where the role of the community, I think, is very important. So we have in the studio with us for his every other month appearance, Associate Professor Dr. Amer Siddiq bin Amir Nordin, consultant psychiatrist from University Malaya Medical Center, but also YB Michelle Ng, Subang Jaya Adun, and a founder of Subang Jaya Care Warriors. So we'll be looking at what the SJ Care Warriors do and how perhaps we could try to emulate this in other communities, and how the role of the community could complement existing mental health services in helping people. And I'm sure, Dr. Amer, you have been very excited today with the news that one of the insurance companies in Malaysia, AIA Malaysia, has just announced that they will cover 6 mental health conditions under their policies. Yes, something you've been working on for a very long time, Dr. Amer.
Yes, I'm really excited and also thankful that finally the powers that be have listened and we've got this particular opportunity.
Just very quickly, Dr. Amer, how much of a game changer is this going to be for mental health care in Malaysia?
I think it'll be a massive game changer with a few reasons. One is that it really shows that the voice of the people make a big difference in getting it across. I'm pretty sure over the last many years, many have actually helped in developing such a program, but for some reason this year, it's really been able to get through the line. Secondly is that now with the opportunity to access health both in public and private, you really open up opportunities for people that might want to come forward with their mental health issues.
And Michelle, you, through your work, working with your constituents, you have an interest in mental health as well. So what were your thoughts on this announcement?
It was something that took me by surprise. I certainly didn't expect it to come so soon. And I'm very, very happy with this development because policy-wise, 2 main things that I'm trying to push for. The first is the decriminalization of attempted suicide. Mm-hmm. And the second is to have insurance coverage for mental health. Yeah.
So 1 out of 2 ticked on your list?
Almost there. I think we can push it further.
So we can add more to your list then.
Yeah, sure.
Well, if you have any questions for us today, you can call 03-7733-2900, WhatsApp 018-789-8899, or tweet us at BFM Radio. I think, Michelle, it's interesting that you've chosen not the platform, but you've chosen to advocate for mental health issues out of many other things that you champion for. Can you tell us a little bit more about your interest in this area?
It actually started after elections, and part of my work is that I have to engage with the community quite a bit at the grassroots level. So what actually took me by surprise in my constituency at least was many people who came to me to say, and these are parents who say that, oh, my children just passed away and that's fine, but the way in which they passed away, they took their lives essentially. So I visit funerals and I have difficult conversation with these parents. And I realized that, they have really done everything that they could. But then the question is, can we as a community maybe support them and do more? And after speaking to professionals, including Dr. Amer himself, I realized that the answer was yes. And there were many programs that were being developed all across the world. And I realized, in terms of suicide prevention, in terms of a resilience program, but I realized that in Malaysia, it is not quite there yet. So since there was awareness already in Subang Jaya, I felt like the need to educate and take it a step further had to be done. So that's why, we came together and we thought, okay, how is it that we construct something for the community to empower them? Because really, at the end of the day, if you think about it, it is the community that is supporting these people who are suffering from mental illness, your parents, employers, friends, so on and so forth. So they are the first liners, and they need to be equipped. So oftentimes we talk about, the policy levels at the healthcare system, but how do we even get these people there? There was that gap that I wanted to address.
What do you think, Dr. Amer?
Certainly. I mean, I've been doing again this work primarily on the receiving end, when people are actually in need and they come over, but we haven't actually gone really to the root of it. And I think in a way the community engagement work that I've been doing has mainly been more on the hospital side. But then when there was this forum that I met up with YB, and also I think YB Hana was there as well, and these issues were discussed and they were very heated. I think it was in Sunway University. I think it was last year. And then suddenly, the local YB said, "Oh, well, we want to do something about it." So of course, people like me had to say, "Yes, we would like to volunteer." But really, when we're on the ground doing the work, it's so much different from when you're on the top, on the receiving end. Because
in what way?
Well, the issues that they come forward with it's just a variety of them, and I think. More and more, we were thinking about not in the curative sense, because when you're coming to see me in the hospital side, in the clinic side, it's actually the curative side. People are already unwell, and we're trying to do something to help them. But actually, there's a bulk of people that are, going to become unwell, and the cheaper way actually in public health is actually trying to get the masses to actually help themselves to hopefully be able to be aware. And hopefully be able to protect their mental health. And I think that's what we've been trying to do with the program in Subang Jaya particularly.
Because if you think about mental health or mental well-being, intuitively it makes sense that you should be looking at it within a family and a community setting. So why do you think we've lost sight of the role of the community?
Well, I think personally it's a lot to do with stigma. And I think it's a lot to do with the fact that people don't understand that health actually means physical, social well-being, and mental health. When we talk about problems with health, we always talk about physical health first. We often forget that mental health is a component of it. And because mental health is often linked with mental illness, due to that stigma, I suspect people don't discuss about it. I mean, in an Asian culture as well, how many times do we actually tell our family members that we love them? It's really not something that is very native to us in that way.
You show it by proxy.
Yeah. So, but people are struggling, and we sometimes are not picking up the signals as it should be. Yeah. So I think this is where that issue of mental health becomes lost with mental illness, and I think you're right. We should now be talking more about mental wellness. And that's what we're trying to promote, actually, in this particular program.
Michelle, stigma. That's I think, the biggest barrier that you're probably dealing with in trying to even introduce this vocabulary of mental health into a community setting, right?
It definitely is. It's one of the biggest challenges, especially if you're talking about adolescents or teenagers. And we realize, at least through the last set of statistics, that these are the people that we really need to address. And it's, not cool to talk about it, not cool to show that I have weaknesses or I'm vulnerable. But the reality is all of us face problems and we need to deal with it. We face stress throughout the day. We go through difficult times. We are sad, and that's fine. But when it comes to a point of overwhelming sadness, how then do we deal with it? Do we still continue to, not address it, shove it under the carpet? Or are we prepared to talk about it? And the way I try to, at least tell my residents how to overcome it is exactly like what Dr. Amer actually said. It's the same. It's physical health. It's the same as mental health. Just as much as you go to a doctor, if you have a fever, if you are depressed or you have anxiety, you might want to see a psychiatrist. Just as how if you have a legal problem, you go to see a lawyer, or if you have a plumbing problem, you go get a plumber. It's the same kind of logic.
But okay, you said teenagers. What about parents? Because I would imagine you'd have to go through parents first to get them to understand or recognize that their children are going through something.
Teenagers, they're in quite an interesting stage of their lives. They're almost going to be adults. And so parents often feel the need to slowly let go so that parental supervision is slowly decreasing. And increasingly, they need to find people that they are comfortable with and, find identity and develop themselves. So they're at the stage where they're most malleable in their lives, but with the least guidance. On one sense, you do need to go through their parents, but as maybe education institutions or as third parties, sometimes they are more comfortable dealing with us as third parties instead of their parents, which is absolutely fine.
Right.
And that's where we come in, because we realize, yes, they're developing, they're the most malleable, they are trying to look for their own identity, and so we try to address this issue from all angles.
All right. I mean, we will get to how SJ Care Warriors, what kind of programs and how you do your outreach in a little while. But, in an overall sense, Dr. Amer, how do you see mental health professionals empowering communities to take up this role?
Well, I think, like I said, it's something also a little bit unique for us. I mean, we do a lot of awareness in terms of mental health programs that we would like to do. And I think this has been the traditional model. We feel there's a problem, therefore we go into communities and we discuss with them about what we think is their problem. But I think the difference between this particular program particularly, and I think evolving from now, is going to be a lot of participation from the community with the relevant stakeholders. Even today we've got two stakeholders. We've got a healthcare provider and also a local leader in the community. And we're trying to work and see what does this particular community need particularly. And I think this is the way to go in terms of building any community program moving forward. And mental health, mental wellness, and mental illness itself is just one of those programs that we decided to work together on because there appeared to be a need within that community. And this is how this particular relationship has started.
Yeah, it's going to be really interesting to find out that the feedback from the community itself driving the program, because you're right, Dr. Amer, from what I've observed, awareness or education programs for the community always involve somebody coming in to give a talk and then it ends there. There's no follow through. So when we come back from our break, I'll be asking Michelle to tell us more about how Subang Jaya Care Warriors really operates. In the studio with me today is YB Michelle Ng Adun of Subang Jaya and also founder of Subang Jaya Care Warriors, as well as Associate Professor Dr. Siddiq bin Amer Nordin, Consultant Psychiatrist from University Malaya Medical Center. We'll be right back on BFM 89.9. Good afternoon and welcome back to Health and Living with me, T. Xiao Ik. We're doing our psychiatry series today and we are talking about the role of community advocates. In the studio with me are Associate Professor Dr. Siddiq bin Amer Nordin, Consultant Psychiatrist from University Malaya Medical Center, as well as YB Michelle Ng Adun of Subang Jaya and founder of Subang Jaya Care Warriors. I think it's time to talk more about Subang Jaya Care Warriors because it sounds really interesting. It sounds to me like a game changer in the way community groups or organizations should take up the role of championing mental health. So, Michelle, how did it come about?
So, in the awareness program that we had last year, where Dr. Amer and Dr. Chan Lai Fung is from UKM, and Dr. Nurashikin from the Health Ministry was also there. So it was after the event, and the group of them were together, and we were just, saying hi to each other. And I said that, look, I'm looking into, let's focus on a awareness program and more on education, because I feel that is lacking. And I talked to them about how, for example, in Australia, they have mental health first aid, where, communities, they administer first aid before bringing the person to a professional. And I said that, I'm considering purchasing a license of that sort. And they said, Michelle, actually, we already have a program of that sort in Malaysia. And I was quite surprised to hear that. And I said that, look, why don't you roll it out in Subang Jaya? Because I think our community is already ready. So in terms of content, it's two-pronged. The first is suicide prevention, and the second is on resilience, a resilience building program. So the suicide prevention program, it was actually crafted by Pek Kai Xuan. He's from a lecturer in Utah University, Tunku Abdul Rahman, and so far we have done two programs. The next one is coming up in August. The second part, the way it came about, was actually through Instagram.
As all things do today.
So I posted a photo of one of our programs, and then June Liang, she chimed in and said that, suicide prevention is good, but I think we need to address the issue earlier, even before it becomes a mental illness. And I said that, that's pretty interesting. So I called her in and I said that, what is it that you have in mind? She said that, look, resilience is important, wellness is important, and we need to impart that with our young people. Let me help you out with that. And I said, great, okay, let's see who can actually drive this forward. So Dr. Tan, he is also from University Tunku Abdul Rahman. He's actually drawing up our resilience program, and the aim of it is to teach wellness and also build resilience within. We're focusing on young people first, our young people, and also teach them how to look forward to things in life despite the challenges that they face. So yeah, in terms of strategically how we actually roll it out, the suicide prevention program was done through our zones. So in Subang Jaya, we've divided it into 4 zones, and each zone we have a group of community leaders represented in a committee. So the aim is to train them first, and once we have trained them, then we want to roll it out into housing areas. For the resilience program, we're looking at piloting it first with Sangway University, and then we'll see how best to roll it out.
Resilience is can be a bit of a catchphrase today. How, Dr. Amer, how can we understand resilience in the context of mental health?
Well, resilience is, in mental health, it's one of the aspects that might at least protect, if not prevent, certain individuals to be vulnerable towards a mental illness. So, like we've discussed in previous sessions as well, it's really a challenging world nowadays, particularly for young people. The amount of issues and the amount of exposure to many things is just overwhelming sometimes. And because people are growing up, or kids are growing up really fast these days, because technology is advancing so quickly most of the time, that communities and also the way that you develop responding to these many issues might not be as quickly. And one of the things that might be lacking or might be left behind is that time to develop resilience. So before you know it, you're in a situation where, the world literally overwhelms you, and then you might have problems. So we're trying to assist people who are vulnerable to be able to be to prevent from developing a mental illness early, and those who probably are still okay, to prevent from a mental illness happening through the program. So there's a little bit of protection and a little bit of maintenance, which is in a way prevention before individual, before other issues happen.
So then, if a program like this is piloted at the do I have it right, the college level, would that be too late?
Well, no. Again, I think as we've discussed before as well, Subang Jaya is a little bit special, I think. As my role, my other role is the director of the University Malaya Centre for Community Engagement. So one of the things I do is actually engage with other communities within the University of Malaya 360-degree sphere. And certain communities, although they're literally next to each other, have different issues. But for Subang Jaya, what I've noticed talking to YB and also the people of Subang Jaya, they have a lot of issues with young people because I suspect they've got a very high density of colleges.
Yeah, we actually have 5 universities, private colleges. So the if you wanted, prevalence is actually pretty high.
Yeah, so in a way, I think it's the right population for this particular community, and I think it's not too late for us to help them. Secondly, is that people coming into colleges will often come from other parts of the country. Yeah. In fact, I've got a lot of people that come and see me from other parts of the world as well that actually live in Subang Jaya, and I suspect again it's because of the colleges there. But more importantly, migration is one risk factor. So actually starting with this population is actually a reflection of probably the community at large. So I don't think it's the wrong population and we're too late. In fact, I think we're just spot on in terms of the risk, the people at risk that we're trying to handle.
I wouldn't say it's the wrong population. In fact, Subang Jaya, I guess, can be quite, apart from the high density of the young people because of the colleges, in terms of income level and all that, can be quite representative of Klang Valley, the urban Klang Valley population.
Yes, I think that's the case as well. And if you're talking about a community's readiness, Subang Jaya is a place where you have a lot of professionals and they're all educated. So for them to, digest complex ideas and for professors or researchers to, roll their programs out, I think it's the most suitable location. Also because Subang Jaya is very close. I say relatively close to a lot of medical centers. So if you want to, for example, determine response rate after going through a program, whether there's an increase or a decrease, you would be able to do it in Subang Jaya.
But taking a step back, what kind of mental health issues are prevalent in a community like Subang Jaya?
Depression is on top. We have also had cases of bipolar and schizophrenia, but that is far less. Amongst the young people, anxiety is also pretty high.
And this is information from self-reporting?
This is information just through my office. So I make it clear to our communities that we are open, and if you need any help, we'll be there to provide you with information on where you can seek help. So that's why we get a lot of people coming forward, either through emails or calls or drop-ins.
Okay.
I think to add on that, what YB said in terms of the prevalence of the mental illnesses that is seen in Subang Jaya is actually reflective of the situation in the country. And also reflective in terms of the illnesses that we would expect in a group of young people. So depression would definitely top the list. Secondly, would be anxiety, particularly panic disorders would be, if you want to be very specific about it. And then, of course, any population, about 1% of them will have bipolar and schizophrenia. So it sort of fits in that bill as well.
So, Michelle, the two-prong approach for Subang Jaya Care Warriors, firstly suicide prevention and then the resilience building, right? How does the suicide prevention, the training for the community leaders, how is that going to ultimately impact the vulnerable groups?
Okay, so in the resilience program, we teach them how to identify signs of suicide, whether it's direct or indirect. And having identified it, we teach them how to engage in a conversation with that person. Because instead of what we discussed earlier, having stigma overwhelm you and shove it under the carpet, we actually teach them, okay, how do you ask the right questions? How do you gain that person's trust? And having gained that person's trust, what do you do next? So we hope to be able to rescue people, if you want to use that word, before something unfortunate actually happens.
Have you seen actual interventions take place and seen the results of it?
I was actually involved in one myself.
Right.
So it was a call. I remember it was a Tuesday because we have our service nights from the fire department to say that someone is going through a tough time and can you come in to talk to this person? And I at that point I was a bit overwhelmed, but I recall that look, you just have to try to gain their trust, find ways to do that. And once you have that, lead that person towards help. So although that is an extreme incident where she was literally on the verge of of taking her life. But that was one instance where we managed to rescue her. So we're quite happy with that.
Okay. I'm coming back again to the role of parents, because if you're talking about being able to identify the signs, helping them build resilience and being able to protect and maintain that well-being, right? I feel that so much of it still is within the reach of parents to change that course of a child's life. How much does Subang Jaya Care Warriors work directly with parents?
A lot of our community leaders are parents. They are also employers. And we want to train them first because their contact point is pretty high. A lot of our community, our residents refer to them for different problems, all sorts of problems. So if they are trained, the idea is that there will be a trickle-down effect. But I also have to say here that a lot of time spent by our kids is not just at home where parents are supervising them, but also in schools. And for those who are working, teenagers who come to Subang Jaya, for example, and they have to take up a part-time job, they also have employers. So what we try to advocate as well is that it's a collective responsibility, because yes, you can be stressed out in school just as much as it exhibits at home just as much as at work. Sometimes you might not have had a great day and you kind of have to do your shift kind of thing. So I think everyone has to be involved.
Yeah. Dr. Amer, maybe first, Michelle, you can explain about who actually, because you're saying, okay, the community leaders who are being trained are people within the residential areas. So that's very much a voluntary basis. They're lay people. They're not people who might necessarily be trained professionally to deal with mental health issues. So how do you protect them as well? Because it's not easy to be somebody providing a service, so to speak.
So the way we train them is to take them as they are, exactly like what you say. We don't expect them to be professionals by the end of the course. In fact, the kind of education that we provide them is rudimentary because it is supposed to be that way. They are not professionals. They have not gotten their PhD. They have not done their masters. So, for example, we tell them, we tell them a direct sign of suicide. For example, if someone actually sees it, an indirect sign might be, a change in lifestyle. For example, extreme change in lifestyle. For example, giving away something that's very precious to that person. So, if you identify these signs, you might want to ask them, for example, are you okay? Do you need to talk? And if they tell you, look, I'm going through a difficult time, or I've actually contemplated suicide, then you can tell them, come on, we can do this. Let's go and seek help together. So we take them as they are, and we don't expect them to provide services as a professional.
Dr. Amer, what are your thoughts there? I mean, eventually working with communities comes down to that, working with lay people.
Well, I think it's fantastic. I mean, like what we were saying, even in the first workshop that we did together with the community leaders, the whole idea is for them to, basically we're trying to demystify mental illness, suicide, and access to help. So once individuals, or at least community leaders know that this is what you should do, this is what you would be expecting, and these are the kind of services that are available and where to find them, people are more likely to be a little bit more in control. The whole idea with mental illness, unfortunately, at sometimes it's almost like the stigma itself prevents people from talking about it. Therefore, people actually have assumptions about what it is and how to access help. Who are these doctors that they have to see, or who are the psychologists that have to see? It's almost like you become some different entity than you really are. And I think the whole idea about the suicide prevention workshop particularly is actually trying to demystify that, trying to give them some practical tips of how to respond, but more importantly, showing them the right way of where to access help and the levels of help that one can give. So one is just to direct individuals to where help is available. Of course, the second one is probably to tell them exactly where you can find the help. And the third level is, bringing that person all the way to help. So there are many levels of help, but knowing that at least we might be able to save at least one life.
Michelle, how does SJ Care Warriors make those connections for your residents in terms of helping them to access the help?
So besides the training, I also let them know that through my office, we have the information available. So if they're unsure about what exactly they are supposed to do, I'm literally a phone call away. So we have structured the community in such a way where at least each residential area has someone that looks after it. So I communicate through these people, and these people, they should have the information already, but if they are unsure, then they can always refer to me.
Okay, I'm thinking 2 points there. Number one is sometimes information about where to go is not enough, is it? That taking that first step to go to a hospital, for instance, or a center, being brave enough to wait through, we know it's bound to be a long wait, and how they speak about their challenges. They may need somebody to be there for them. Does SG Care Warriors do that?
We don't do that. We try to educate them and empower the community because we feel that we can only do so much. But with more people on board, of course, the reach will be wider. So I always tell my communities, Michelle is only one person. Michelle only knows so many people, but each person knows someone and they can do their part as well.
Because the other thing I was thinking about is eventually the idea is for people to be self-reliant. And to, like you said, to be empowered to seek those channels themselves. We have Associate Professor Dr. Siddiq bin Amer Nordin, Consultant Psychiatrist from University Malaya Medical Center, and YB Michelle Ng Adun of Subang Jaya and founder of Subang Jaya Care Warriors in the studio today. We're talking about the role of the community in improving and maintaining mental well-being. We'll be right back after the market update, where I would like to ask Dr. Amer about how can we see this being replicated in other communities, especially different demographics as well. So we'll be right back on BFM 89.9. Good afternoon and welcome back to Health and Living with me, T. Shawiq. In the studio with me today, Associate Professor Dr. Siddiq bin Amer Nordin, Consultant Psychiatrist from University Malaya Medical Center, and YB Michelle Ng, Subang Jaya Adun, and founder of Subang Jaya Care Warriors. SG Care Warriors is shall I describe you as a community-based organization?
Yep.
That is doing something quite innovative in addressing mental health issues within the Subang Jaya community through training community leaders on suicide prevention methods, as well as piloting a resilience building program with young people in the community. Dr. Amer, just very quickly, do you see something like this being replicated in the rest of Malaysia?
Yes and no. I think, yes, this particular program that we've done together looks like it's possibly replicable. However, I think what's more important is the community that we actually approach probably need to have a certain type of problem that we might want to address. And again, this can only be done by talking to both the community leaders, the aduns, and also the community leaders within the community before we actually rolled out. Like I said before, traditionally, it can get quite sexy. This thing is working for Subang Jaya. We think that it can probably work for other places. We go to other places, we do the same thing. It doesn't work because they don't have that problem. But I think in terms of the whole objective of it, trying to get people to at least be able to talk to another person, at least saying the right things, making the community aware about what healthcare facilities or mental health services that are available within their particular area definitely is something that is replicable. Because what's more important and what we've noticed is that sometimes even, within, like, for example, our hospital, the community around us doesn't really know how to access the help that the hospital has. And I think that's quite, in a way, sad. So these kind of community activities allow at least the community to know what services are available within the community, and hopefully that will be able to help them if they are in need.
If you mean that they don't know how to access the hospital, let's say, is it purely lack of information, or that the barriers is too insurmountable?
I think it's both. One is the lack of information about what healthcare facilities can do what. So, for example, in mental health care, first of all, you need to know the players in the mental health scene. You've got, of course, the medical doctors, the psychiatrists on top. Then you've got maybe, for example, the healthcare clinics. You've got general practitioners that might be able to help. You've got psychologists, you've got counselors, you've got social workers, you've got psychiatric nurses. There's a whole host of people that can actually assist individuals. Within schools, you've got your counselors. Within universities, you've got also your counseling unit for some universities. So there's a lot of opportunity, but if you're not sure who they are, it's very hard for you to access that help. Then secondly, of course, is knowing what's available in what facility. People come to, for example, a small clinic and expect to see a specialist, for example. Probably not the best place to go. People come to, say, maybe a hospital expecting to be able to automatically enroll in psychotherapy. Probably also not feasible in that sense. So people need to know what's available within their services so that they can actually access the kind of help that they want. Then, of course, you've got the issue about whether you want to see it publicly, where there might be a big waiting time and the expectations of that, or whether to see in private practice, for example. And again, there might be differences in that, because some hospitals might have visiting psychiatrists and psychologists, some of them might not. And of course, you've got the many independent players within a community. So there are certain places that might have a whole host of private psychologists and psychiatrists and counselors, and there might be some communities that you don't have anybody at all. So just knowing what's available itself probably is going to be a game changer, and I think that's where this particular community activity particularly really tries to help the people within the community to prevent and also protect their mental health. But if they are struggling, someone in the community knows which service to access and at what level. And that's where that program that YB was talking about is very helpful, because it's really just providing a conversation to destigmatize the issue, and then providing or leading the individual to the help that they need.
We have somebody who messaged on WhatsApp asking on behalf of a friend who has been having suicidal thoughts and wants to know, she wants to know how best to encourage someone who is suicidal to seek the right help. How could her friend choose the right community?
Awesome.
It's a bit difficult to really say, how do you choose the right community, isn't it? You are within the community that you are in.
Yeah, well, exactly. I was going to say move to Subang Jaya. The activities there. We're giving this show
Subang Jaya can only cope with so many people, isn't it?
Well,
Okay, so what we in at least in the program we teach them is we teach them how to ask, have you thought about taking your own life? And sometimes that is a difficult question to ask. And we train them to ask that question. Like we actually have a group activity where you learn how to ask that question. And you'd be surprised. We give them 3 minutes to ask that question. Some at the end of the 3 minutes can't even ask that question because it's a difficult question to ask. And it takes a while to gain that trust. And sometimes it takes days or weeks. But the key point is keep at it because you need to gain that person's trust in order to seek help together. So it is very easy to say, oh, I think you need to go and see a doctor about this. Maybe you might want to change it up to say, why don't we go and see someone about it? Do you want me to drive you there, for example? Would that help you? And maybe, if you need a ride home, I can provide you that as well. So it's about being a community, about providing the support that this person needs.
Another question on WhatsApp is, what support do you give to those who have schizophrenia? This is specific to Subang Jaya.
Right. Okay. So as Care Warriors, we don't provide counseling. We also don't provide psychiatric services because we're not professionals. This group of people who have come together, the professionals come in their advisory capacity. The rest of us are volunteers, so people who are interested in mental health and want to bring this forward. So what we can do is provide you information on where you need to go. So schizophrenia, you would need to take medication. So please go and see a doctor about it. You can access them through public hospitals. Some private hospitals like R. Damansara Hospital provide mental health services. But correct me if I'm wrong, Dr. Amer, I think all of our public hospitals provide psychiatric support.
Yep. So all the big public hospitals will definitely have it, and the Ministry of Health is actually populating the smaller hospitals with psychiatrists as a graduate.
Okay. And have there been... have you faced walls being put up, in you trying to reach out to the community? Have you faced resistance?
I don't think it's resistance. It's more of a lack of awareness of what they are dealing with. So let me give you one example. There was a case where I noticed I noticed that a child of this parent was not behaving as how they should be, and I said, I think you really need to take this seriously because it looks like your child needs help, and the parent wasn't aware that this was something that they could get help for. And in fact, when I said that I think you need to see a doctor and take medication about it, the parent said, well, it might just be stress, so maybe we will just send her for a sand therapy class. It took a while for me to tell them to say, I think it is more than that. I think it is something that needs to be diagnosed. And true enough, I think for that case, it was schizophrenia. And the parents, thankfully, the daughter was still quite young, and so she was able to come out of it. And I think that that's a message that you want to drive across as well, that the earlier you identify it and the earlier you seek help, it is more likely than not that a person will be able to recover. So this person now is leading an absolutely normal life.
Dr. Amer, do you know of other communities? It might not be in Malaysia, but other countries that have adopted innovative community-based models as well?
I mean, I have to admit that I was seeing somebody yesterday in clinic, and there are certain communities, international communities that have come together that have developed something like what we've developed. They've noticed problems within the community. So the one that probably good shout out to say is the Sudani Society, where they have noticed some problems within the community, and they're, as a community, looking after each other. So there was an individual within the community that probably required help, and they brought them across to seek that help. And I'm pretty sure that there are other communities like this, but it's just something really heartwarming to see that happening yesterday, because they were not related. I was wondering, I thought they were one family, but apparently they're just literally a family of people of the same group that wanted to help each other, and one was identified to have a bit of a problem, and they sought that help.
And I guess when you are in the community has somebody as invested, the leader. If I can put you in that role, Michelle. You describing that you've noticed changes in a young person's behavior in your community, that's pretty amazing, because that must mean you know them very well.
We try to bring our communities together because I noticed that for Subang Jaya, our strength is in our community, not just in this aspect, but even in terms of crime prevention. It is because of our community that we saw literally a 20% decrease. So leveraging on that, we decided to expand this initiative through them as well.
So what would you say that you can do more of in your capacity as Adun to continue to champion mental health issues?
What I really want to see more is at the policy level. So we have a step in with regards to destigmatizing suicide, attempted suicide. The Deputy Prime Minister announced that there was an interministerial meeting that was held about mental health, and the Attorney General has been directed to study it. So that has taken its own course, and I'm quite pleased that there is development. Even insurance, we also heard that AIA has introduced insurance coverage for six types of mental illness, but I think it can be taken further. So, like for example, with decriminalizing attempted suicide, do we just stop at that, or do we go further? Because like it or not, the police are still going to be called when there's such an emergency. Do we need to train them? Teachers, do we need to go into schools, for example? Our firemen, they'll be called as well. Do they need to be trained? Is decriminalizing the be all and end all when it comes to this? Even insurance, yes, we have one insurance company that is providing it now, but do we want to talk about more competitive pricing, for example, getting more of them involved? So there's still a lot of work to be done. I think it's in at least my capacity as a policymaker, trying to push those initiatives forward.
We will definitely call you back in.
Sure, thank you.
And Dr. Amer, do you have a final message?
Well, first of all, again, I think this is the way forward, working with communities for any issue, particularly mental health being one that we are particularly passionate about. But I think more importantly, in terms of the little wins that we've had, the decriminalization, or at least the discussion or conversation about it, of suicide, and also the recent introduction of mental health insurance, it's really when people talk about it. So one of the messages across by the health minister from the inter-ministerial meeting was the campaign of Let's Talk Malaysia, or hashtag Let's Talk MY. Why is it important to put Let's Talk MY? Is because if you put Let's Talk, there's thousands of conversation happening across the globe, and we're hard to then listen to what the people want. And I think Let's Talk Malaysia allows us to then find what we need as a country, and what communities need within their own communities, so that we can actually bring this conversation forward. Because, it's very obvious that when we're talking about it, more awareness happens, more volunteers come forward, and also, more importantly, more changes happen.
And remember, if you are struggling with some issues and you need someone to talk to, you can call Befriend Us KL at 03 795 68145.